Sickle cell anemia. Welcome to Medvids Made Simple. Please do me a favor by hitting the subscribe button so that you can keep watching all my upcoming videos as soon as I upload them. Sickle cell disease is a hereditary hemoglobinopathy, so it is an inherited condition in which there is production of defective hemoglobin. Abnormal hemoglobin which is produced in sickle cell disease is described as hemoglobin-S, in short HbS. The normal adult hemoglobin is described as hemoglobin A or HbA. It is composed of heme and globin. There are 4 globin chains in each hemoglobin molecule. There are 2 alpha globin chains and 2 beta globin chains. So what happens in hemoglobin S, that is in sickle cell anemia, is that the primary thing which everyone must remember is that the glutamine amino acid in hemoglobin A is replaced by valine. Okay, so glutamine has to be there and it is replaced by valine. Now, to be more specific, it happens in the beta globin chain of hemoglobin. Okay, so that too in the 6th codon of beta globin chain, to be even more specific. So we have hemoglobin, right? Heme plus globin. Globin has 2 alpha chains and 2 beta chains. In the beta globin chain, we have so many amino acids. In the 6th amino acid, which has to be glutamine, by mutations, by a point mutation, what happens is that the glutamine is abnormally replaced by valine, leading to production of defective hemoglobin called hemoglobin S. Now, let's talk about the pathogenesis of sickle cell disease or sickle cell anemia. Deoxygenation of hemoglobin S is what actually is the primary event which happens in formation of sickle cells. This deoxygenation of hemoglobin can be precipitated by various triggers like infections, dehydration, and so many other factors. And the deoxygenation of hemoglobin S favors polymerization of hemoglobin S. You can just imagine these hemoglobin S molecules to abnormally stack on one another, and this leads to stretch of the RBCs, leading to formation of sickle-shaped RBCs. This leads to hemolytic anemia, which is destruction of RBCs, microvascular obstruction. These sickle cells go and obstruct the small blood vessels throughout the body, affecting the vital organs, and ischemic tissue injury. So these 3 are the core things which happen in sickle cell disease and are very important in the pathogenesis. So you must remember these 3, and with these 3 you can remember all the things about sickle cell disease. Okay, so hemolytic anemia, microvascular obstruction, ischemic tissue injury. So you all must have heard about this concept of sickle cell trait. Let me make the concepts clear about sickle cell trait. It is very common in Africans. So as we all know, sickle cell anemia is an autosomal recessive disease. The 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 heterozygotes are usually not affected by the disease, but they rather become carriers. So if 2 heterozygotes marry, what happens is that there are chances of that their offsprings can develop the disease and manifest as a sickle cell disease. Okay, so these heterozygotes will have hemoglobin which is described as HbAs. So they will have hemoglobin A as well as hemoglobin S in varying proportions. So most of you guys will be already aware of the fact that sickle cell trait is actually protective against malaria. But do you know how? Let me explain that. First of all, you must be remembering when I explained about the pathogenesis of sickle cell disease. Uh, Deoxygenation is what is the prime event which is responsible for sickling of hemoglobin, polymerization of hemoglobin S, leading to sickling of RBCs. If you remember that, what happens is that if a healthy red blood cell is infected by malarial parasite, what happens is that the malarial parasite normally consumes the oxygen which is present in the red blood cell, and it also decreases the intracellular pH, making the intracellular pH of the RBC more acidic. Okay, So when it infects patients, when it infects the RBC of a sickle cell trait um, person, what happens is that it consumes the oxygen in the RBC and it decreases the intracellular pH, making it an acidic medium inside the RBC. So as we know that decrease in oxygen, that is deoxygenation, favors sickling in case of sickle cell disease, right? So since these patients will have HPS in their RBC, uh, when there is decrease in oxygen caused by consumption of excess oxygen by the malarial parasite, it favors sickling. But you may be wondering how those RBCs were normal before the malarial parasites invaded them, right? That is because they have hemoglobin A in certain proportions. This hemoglobin A will prevent sickling from occurring, and these people be normal until getting infected by malarial parasites. Okay, so when malarial parasites infect them, what happens is that they consume the oxygen in their RBCs and decrease their intracellular pH, which favors sickling of RBCs. And once sickling happens, these abnormal RBCs containing malarial parasites are cleared off by spleen of those patients. Okay, so that's how malaria is getting cleared. And another mechanism is that uh, it prevents the formation of certain membrane knobs uh, containing a protein called Plasmodium falciparum EMP, which is in short PFEMP1. Okay, so this is one of a very important protein for the malarial parasite, which helps the parasite for adhesion or attachment to the endothelium of the blood vessels. This is very important, especially in the pathogenesis of complicated malaria like cerebral malaria. So since this is prevented, the cerebral malaria can be prevented, or the chances of getting cerebral malaria can be reduced in cases of people with sickle cell trait. So these two are the defensive mechanisms which protects the people with sickle cell trait from getting infected or from getting complicated malaria. People with sickle cell anemia can have prominent cheekbones. This is because of bone marrow hyperplasia, and X-ray of skull can reveal an appearance known as crew-cut appearance. These are because of extramedullary hematopoiesis. In patients with sickle cell anemia, there is excessive destruction of RBCs, so the body has to compensate for that by increasing the production of RBCs from other sites than the normal sites of RBC production. So the bones in other sites of the body and other organs like liver has to compensate for the production of RBCs. So what happens is that you can see that the malar aspect of the face, that is the malar bones or the cheekbones, are prominent in these people. That is because of bone marrow hyperplasia in the cheekbones, leading to extramedullary hematopoiesis. As we all know, sickle cell anemia is a hemolytic anemia. So these patients will have hemolysis, which is destruction of RBCs, and that is in sickle cell anemia it is more of uh, extravascular hemolysis. Okay, so that mainly happens in spleen. Intravascular hemolysis also happens, but extravascular hemolysis is more compared to intravascular hemolysis. So because of hemolysis, there is elevated bilirubin levels in the blood circulation, and in hemolytic anemias, as we all know, unconjugated bilirubin is elevated, and it is not the conjugated bilirubin which is actually elevated. Okay, so remember that it is unconjugated hyperbilirubinemia, and because of hemolytic anemia, there is excess deposition of bile pigments in the gallbladder, which can precipitate formation of gallstones. And these gallstones, since they have excess of bile pigments, these gallstones are called pigment gallstones. So there are various things which happen in the spleen of sickle cell anemia patients, and it's worthy of discussing them in detail. So initially, children affected with sickle cell anemia will have mild splenomegaly. So it is barely just palpable below the left costal margin. And then what happens is that because of various pathologic things which happens, like sequestration and all that, the sickle cells will get accumulated, or they make the circulation sluggish in these people, and they can clog the blood vessels in the spleen, leading to splenic infarction. And repeated episodes of splenic infarction can cause fibrosis of the spleen, and this can progressively lead to shrinkage of the spleen. Okay, so in the end stage, uh, what happens is that just a small fibrotic tissue remnant of the spleen may be remaining in the end, which is functionally not useful for that patient. Okay, so this is what is described as autosplenectomy, which is actually very interesting. That in the end, what happens is that the spleen of the patients with sickle cell anemia gets destroyed by itself. Okay, so that is autosplenectomy. So there are various crises which happens in sickle cell anemia, and these are actually very important to understand. So first of all, the most important crisis of all, which we all must know, is vaso-occlusive crisis. Okay, so this is because of occlusion of the blood vessels by the abnormal sickle cells. Okay, so this can affect various organs. I'll talk about everything in detail. Okay, it's very easy. Just keep following. So it can affect the bones. For example, in children, it can affect the small bones in the hands and feet by by causing obstruction of the small blood vessels which supply these bones. This can lead to dactylitis, and this is what is classically described as hand-foot syndrome in children. And in adults and even in children, it can affect the lungs by affecting the pulmonary microvasculature. This leads to cough, chest pain, acute chest pain, which can be very severe, breathlessness, hemoptysis, and all that, which is classically described as acute chest syndrome. And it can affect the liver and cause infarction in liver. It can affect the brain and can even cause stroke. It can affect the spleen and cause various manifestations like the things which I've explained already. And it can affect the penis in males, leading to priapism, which is painful erection. And in adults, one of the common things which can happen is that it can cause non-healing chronic ulcers over the extremities, especially over the legs. Okay, so these are some of the vaso-occlusive crises which happens in sickle cell anemia. So the next crisis is sequestration crisis. This happens in children with intact spleen. Now, what is sequestration crisis is that in some people what can happen is that the excess of sickle cells along with the plasma can get sequestered inside the spleen, and the total blood volume in the most of the blood volume in the body can get sequestered in the spleen along with the sickle cells. This causes hypovolemia, and this can lead to even shock in the patient, and this can be associated with severe morbidity, and this may even require blood transfusion in certain cases. It can be so severe. And another crisis is called aplastic crisis. If patients with sickle cell anemia is infected with parvovirus B19 infection, they can develop aplastic anemia, which is decreased production of blood cells. So on a long-term basis, because of chronic hypoxia to all the tissues in the body, what can happen is that there can be impaired growth and development of the child overall. Okay, so there can be stunting, and there can be poor development of the child in all aspects of milestones. And the organs like heart, spleen, kidneys, and lungs, which are very important organs, are usually affected because of hypoxia. Okay, so the tissue perfusion is decreased because of obstruction of microvasculature, and that is a mechanism for these vital organs to get affected. So just a summary of the clinical features which I've told. It can manifest as hemolytic anemia leading to jaundice and pigment gallstones and various vaso-occlusive crises. like it can affect the bones, especially the bones in the small bones in the hands and feet, leading to dactylitis, which is hand-foot syndrome in children. It can affect the lungs, leading to acute chest syndrome, which is cough, breathlessness, hemoptysis, and severe chest pain. It can affect the spleen, and on a long-term basis can cause autosplenectomy. Can affect the liver and cause infarction. Can affect the brain and cause stroke. It can affect the penis in males and cause priapism, which is painful erection, and it can cause chronic non-healing ulcers over the extremities, especially legs. And it can cause sequestration crisis, which can lead to hypovolemia and can even lead to shock, which may even require blood transfusions in certain cases, and can cause aplastic crisis, which is caused by infection of patients with sickle cell anemia with parvovirus B19 infection. So peripheral smear findings in sickle cell anemia are actually very easy. As we all know, we can see sickle cells, as we can see in the picture over here, and we can see reticulocytosis, which is elevated reticulocyte count. That is because of a compensatory mechanism for excess destruction of RBCs. There will be elevated reticulocyte count. Target cells are these cells which you can see over here. So yeah, these cells are target cells. These target cells usually indicate hemolysis, and you can see Howell-Jolly bodies, which are abnormal RBCs which has nuclear pigments remaining inside them. So usually these kind of RBCs are removed by the spleen, okay, they're destroyed by the spleen. But since these patients, as I've told you, will have autosplenectomy, they don't have functional spleen, so the spleen is not able to remove these cells. So you can see those cells in the peripheral smear. So those are described as Howell-Jolly bodies. So how do you diagnose these patients? First of all, by clinical features. The typical clinical features will be present in most of the cases. So if you remember the clinical cases, it's fine. If you don't, please rewind the video and watch it once again. And the peripheral smear findings, as I've already described. The metabisulfite test is a test which can be used to diagnose sickle cell anemia. If you cannot see the sickle cells apparently on the peripheral smear, what you can do is that you can take the blood sample from the patient and add a thing called metabisulfite to that, and this can induce sickling and formation of sickle cells. Okay, so that is one test. And you can do electrophoresis with the blood sample of the patient, and it can detect the presence of hemoglobin-S, and there can be elevated unconjugated bilirubin. That is because of hemolysis. Prenatal diagnosis can be done in the intrauterine life by amniocentesis or chorionic villi sampling to detect the presence of sickle cell anemia in the fetus. There's a drug called hydroxyurea which acts by inhibiting DNA synthesis. The mechanism of action is that it increases fetal hemoglobin, which is HbF levels. Okay, so how is that beneficial? Is that the fetal hemoglobin has higher affinity for oxygen, so it won't leave the oxygen very soon. Okay, so as we all know, the main pathogenic factor which is responsible for sickling is deoxygenation. So if there is more of HbF, there will be less chances for deoxygenation and less chances for sickling. That is one mechanism, and it has anti-inflammatory effects. Okay, so since it inhibits DNA synthesis, it also decreases the production of leukocytes, okay, the WBCs. So this leads to decrease in inflammation. So these are the mechanisms of action. You can do hematopoietic stem cell transplantation in some patients where it can be helpful. So since the patients with sickle cell anemia are prone to develop autosplenectomy, the capsulated organisms like pneumococcus and Haemophilus influenza will not be able to be destroyed by the body. Okay, so the capsulated organisms are generally cleared by and cleared or destroyed by the spleen. So since these patients won't have intact spleen, they won't be able to handle these organisms. So to handle these organisms, we have to immunize them by providing vaccines against these organisms. Okay, so this can help to prevent or reduce the chances of getting pneumonia and meningitis by these organisms. So we came to the end of this video. I hope you understood or learned something new in this video. If you did, please make sure to hit the like button and tell me how you felt about this video, what you felt about this video in the comment section below. And make sure to share this video to your friends, and most important of all, please make sure to hit the subscribe button. If you like my work, if you want to support my channel, you can do so by donating on www.patreon.com/medvidsmadesimple. And as always, please make sure to hit the subscribe button, and I'll see you guys in my next video. Thank you.